And again, these images appear to be a Marble Cave. And I sent him also to Farron Tire. Remember, he's come on a few times. He did a video recently over at Marble Cave where he swam in it, and yeah, it looked nothing like this. So,
No.
yeah, very disturbing. 724. Let's go ahead and head into the KUAM News Zoom room where we're going to catch up with the chair of the Physicians Advisory Group, Dr. Hoa Nguyen. Good morning, Doc. Long time.
Hi, Doc.
Good morning, guys. Good morning, Chris, Sabrina, Jason.
Uh,
Good morning.
Doc, to give you the latest, we have the latest numbers here. Our vaccination rate, oh, this is taking so long, 79.91%.
104 more shots to
I
go.
know.
Go get vaccinated.
Yeah,
Come on.
just a few. I think a few hundred shots, and we're gonna get to 80%. But it's we have a lot of people, 1,000 people that I think 4 or 5,000 people that have the first shot but never
Mm-hmm.
finish and complete the series. And we really like for them to come in and complete it, so that way they can be fully vaccinated and fully protected at 95%. Doesn't matter how late you are. Really highly recommend you do that, especially we know that the Delta variant more likely is here in Guam already. Um, so I really tell people to come in and get the shot. It's not a good thing when we're going to open all the restriction and you're not protected. From the clinic standpoint of view, we start to see some breakthrough positive from the fully vaccinated people, and they're not sick, and that's what the purpose of the fully vaccinated is that if you catch the virus, you're not going to be that sick and you're not going to be end up in the hospital. But we are seeing case now. Yesterday, there's 3 cases that fully vaccinated person have some cold and cough symptom that are positive for COVID. So, I can't tell you enough that it's very important that you get yourself fully vaccinated with the double dose of Pfizer Moderna, and or just come in and finish that thing, because I tell you, we expect the case to go up as the restriction is going to be lifted. Except the mask going to be still mandate for indoor public place. Um, so I tell you, it's here. If you're fully vaccinated, I'm going to ask those people that if you're fully vaccinated, if you have any cough and cold symptom, please protect your colleague, your family, and go in and get tested to make sure that you don't have the infection. Okay, but again, you're not going to feel that sick, but you're going to have some cough and cold symptom.
Doc, I mean, 79.91%. It's got a little ridiculous. That's practically 80% already.
I agree, Chris, and I think that probably by the end of this week and next week we should be to 80%, and hopefully the governor will go ahead and release all the restriction again. We were hoping that the business 100% occupancy and there's no restriction on the gathering. But again, the mask is mandated still, so you need to still keep your mask on in the public place,
What did
indoor.
what did you make
Okay.
of Doc? What did you make of the reversal by the CDC about mask use for vaccinated individuals? They come out and said, "Oh, you don't need to wear a mask if you're fully vaccinated indoors." And now they reversed that and said, "Oh, please, yes, wear the mask."
It's based on the Delta variant. For Chris, Sabrina, the Delta variants are so much more infectious than the previous COVID strain, and about 60% more infectious than the previous one. And the hospitalization rate are really, really high, and it affects the young population. So, we're still learning things about this COVID. and um, and you're not going to be surprised if CDC depend on what the variants and how infectious they are. They're gonna still gonna switch back and forth on this thing. Everyone want to go back to normal, right? But at a certain point, when the variant prove itself that is so infectious, yeah, CDC's responsibility is to tell people again, wear your mask even you're vaccinated. Then that's the part where people understand that the fully vaccinated people with the Delta variant, if you're symptomatic, even if you have just a mild cough and cold, the viral load is so much higher than the previous COVID strain that you can still give to the next person. So that's the part where the more they find out about the Delta variants, they have to make the adjustment on the mask mandated. Um, yeah, I agree. They need to go back and reverse that just because we find out more about this Delta. And again, it's spread like crazy in the state at this point, and I'm very sure. I know we don't have the any study back from CDC yet, but the Delta is here, and that's how we see the breakthrough positive on the fully vaccinated people. Remember it go down from 95% protection from getting infection down to 80% now on the Delta variant. So it is more infectious than the previous strain.
Doc, I think I saw some national media reports. So we even had a case of death of a fully vaccinated individual here. But are you hearing anything or tracking anything stateside about hospitalizations of fully vaccinated individuals?
Yeah, it's rare to see the fully vaccinated people in the ICU or die from the COVID. It's still a rare number. Again, 96% of the people in the ICU in the state are unvaccinated people. So that's an overwhelming number when you compare to the vaccinated population. Again, 96% of everyone in this intensive care unit admission in the state are not vaccinated. So, the statistic is there. The only thing that you can do is that you need to get yourself fully vaccinated. So that way, the chance you end up in the ICU is much, much smaller. And that's the key. It's not to get rid of the virus, nor to protect you from getting the virus. It's just that it won't make you that sick. And that's the whole purpose of it, is to decrease the hospitalization and also decrease the death from the COVID. The pretty Sabrina, the message have to go out public that, if you miss one dose, and go in and get the second dose. Take your time, and that's something that we find out in the clinic is that people say, I need to make time to go in and get the second dose. Take your time until go to a clinic, go to public health and get your second dose in. We really need it. We don't need to see you in the hospital. Truly protect yourself and your family by doing that. Okay, so we are doing good. So we have like 4 people in the hospital. Again, the majority of them are not vaccinated or partially vaccinated. So you really need to really protect yourself. Okay.
Doc, we have a question from one of our listeners, and they're asking whether or not if they got their shot on January 29th, is it too late to get their second shot?
It's never too late. I tell you, just think about it as a booster shot for your vaccine. So you really need to come in. Doesn't matter you get it in January or December. If you miss the second one, please come in and get your second shot. So it's not too late. And just think about the second shot now as you pass your 6-week mark as a booster shot for your vaccination. So please come in, and there's a lot of clinic everywhere. So just come in and get your second shot.
So is the physicians advisory group, are you guys still meeting every week? W- w-
No, we don't meet every week, but probably tonight we probably need to meet just because I tell you we like the school are coming up,
Yeah.
face to face, and we need to talk about that, and also, there's a few more positive in the fully vaccinated personnel that we notice now in the clinic. So we gotta start talking about see what's going on here.
Mhm. And the people that are coming in that are fully vaccinated, how sick are they?
They like I said, they have very mild symptoms.
Mild.
Just like you have a cough and cold, they don't have the typical COVID symptom like loss of taste and smell or shortness of breath or anything like that or high fever. They just come in like a URI, cough symptom. That's it, and that's why we now that we know that with the Delta variants, even you have this mild symptom, the viral load is so high, Sabrina, that they can still give to other people. And that's what concern now is that the fully vaccinated people now are spreading the virus to the unvaccinated population. Just because, if I don't feel that sick, so I might not pay attention so much. I might show up to work. I might show up to a party. And in those places, if you have an unvaccinated personnel, they're going to get the full burden of the Delta variants.
What about natural immunity as a COVID-19 survivor?
Yes, the natural immunity for people that have COVID infection before, it does not cover the Delta variants. So you will get infected again with a worse strain. So that's why it's highly recommended by CDC that the natural immunity that people with the virus of COVID infection in the past to come in and get the vaccine. Because we know the vaccine, at least right now, the study showed us 80% coverage for the Delta variant. So they're not protected from this new strain.
Any word on booster shots, whether or not we're going to have to be subjected to that?
Yeah, there's no word for that one yet. I mean, we probably hear something in October time frame. Because the first shot coming in December, so hopefully in October, we hear something. Myself, I got my first shot in December, so I'm getting toward the end here. But also, some studies show that the mRNA vaccine, it might have a longer lasting because of memory cells, so it might work a bit longer. So again, it's a new vaccine, so they still have some new study coming out, so we'll see what happens. But yeah, probably Sabrina, Chris, probably sometime October, November, hopefully we hear something. But for right now, I know we get to 80%. We cannot slow down the vaccination clinic. We still need to push it. We need to make sure people complete their second dose.
Okay. By the way, did you go to that GMS meeting last night?
Yes, there's a lot of us attend the meeting, and it's a concept that we want to push out, to make sure that the most important thing is to make sure that Bill 112 does not pass, and also to make sure that the patient and physician need to have an open dialogue in order to work out the issue. There might be some misunderstanding, might be some educational stuff, but we like to make sure that the patient have full access to the physician, the provider, if they have anything that they think is a mistake or an error, whatever. Those communication need to be fully mandated to make sure that the physician, the provider, the hospital sit down and talk to the patient face to face and try to answer those concerns of the patient. Because I tell the majority of the cases that there's no communication within the patient and the provider, the hospital.
Mm-hmm.
And that's the key here is they need to sit down and talk before they go to any type of arbitration or any type of litigation in court. That's a headache for everybody. So yes, it's a very good meeting. We hope that we will bring this concept to the senator and have them discuss in the public, so that way, we can all work together to improve the quality of care for Guam.
Right. And you talk about the communication between with patients. What about with these politicians? Has there been any talks that maybe you've had or anybody from GMA and GMS has had with Senator Terlahi since those public hearings were held?
I think
To hopefully
the
work
last
towards some
meeting
sort of a
is,
compromise?
yeah, the last meeting we have, I think it was about 8 to 10 senator, including Senator Talahi. It's a roundtable discussion with the physician, and it went quite well. So no, we're going to come back and work on our proposal, and we're going to present that to them again. And I think it's going to have to be after the budget hearing or something, so that way the Senate can concentrate on the budget, and then we're going to approach them again in sometime in August, and happy and confident that the senator are willing to sit down and talk to the medical community. So I think that hopefully it work out well for everybody, because we all have the same goal. Chris Sabrina, is basically make sure the patient are protected, the physician are protected, and we all move to make sure that we continue to improve the quality of care and the access of care for everyone in Guam.
Yeah, we certainly hope you guys can work something out, because watching those hearings was quite painful to see. The frustration from both sides, right? From the patients
I agree,
and
and I
the
tell
providers.
you from my personal standpoint of view, Sabrina, Chris, we all here. I tell you, we're all here for to make sure that we protect the patient, right? Because the patient, to me, is part of my extended family. So we really need to make sure that we provide the best care for our family and our patient, and that's all our goal is. And again, the communication part is the most important thing. I think it will solve the overwhelming majority of the case. You're not going to be 100% on anything you do, but at least that you open that for the majority of people to make sure they're able to sit down and talk to the provider, the hospital, in a way that they can work out some misunderstanding, some issue that they think is a problem. So I think the discussion, the open communication, the most important thing, and hopefully it solves most of the case from right there.
All right. Any final word? Oh, Chris.
I just wanted to go back to the PAG doc. So when we do get to PCOR 4, what recommendations, and do you know what the conditions will be?
Chris, I think we get PCOR 4. I tell you the mask mandate is definitely 100%. I don't think we're going to get away from that for next year or so. It's very important as the new variants coming out, and I think the thing that we can do to protect ourselves is use our masks, and that's the thing. So that's the main thing that we want to do is mask mandate. Push the vaccination. And again, we're going to talk again on the mandate on, certain entity on the vaccine. As you guys are aware now that the hospital in Houston, they won their case in the federal level on the mandate on vaccine on the healthcare worker. So, that's something important that we probably need to talk about. I know GRMC mandate their work, the employee to get vaccinated. So does AMC. No, we're 100% vaccinated. And as a healthcare worker in the front line, it's our responsibility to protect ourselves, protect our patient. So I think it's very important that in certain position that you hold and the exposure to the people you're taking care of, you have to protect yourself and protect the patient. So mandate vaccine is something that is going to be talked about a lot across the nation. I know the hospital that where my brother and sister work in Pensacola, Florida, starting August, is mandate that every employee in the hospital going to be vaccinated, or they're going to be tested every week, and that's something that is coming up in the near future.
What entities are you referring to or looking at to implement
Especially
this?
the frontliner, Sabrina, Jason, at the hospital, the police officer, firefighter. Those are frontliner that really need to be I think that across the nation, they are talking about mandate the frontliner to be vaccinated.
Mhm. And what happens if they don't?
The hospital in Houston, the federal just say if you don't agree to mandate from the hospital, find another place to work, and that's the federal judge. They went through two level of judiciary already, and every level the same thing. If you don't want to get vaccinated, then you gotta find another job somewhere, and so. And like I say, I think every hospital in the state are waiting for that judgment, and the judgment just came. So most of the hospitals now in the state will be sometime in August. They're going to mandate that.
Mm-hmm. And I would think that perhaps there might be exceptions where the mandatory vaccination policy might not
Yes,
apply.
they have an exception for religious belief. We have to respect that. For people that have some certain medical condition that cannot be vaccinated. Yeah, you have to have those special conditions for people. But I think for overall majority of people that can get the vaccine, they will be mandated to get the vaccine. Like I say, you have a choice of doing that or get tested once a week. Again, you're on the front liner. I think your responsibility is protect the public and protect yourself. So, and that's something that, again, is a very hot topic nationwide. And the hospital in Houston, they won their case again for the second time.
We do have one more question from one of our online viewers, and they're talking about the booster shot. CDC is advising that individuals with underlying conditions should get a booster shot. Will that be applied on Guam?
That applied on Guam too, especially, we have so much comorbidity here, guys. Our rate of diabetes, hypertension, cholesterol very high. So yes, they can do that. I think it's important as we go toward the 12-month mark, a 1 year mark from your fully vaccinated date. It's important to keep an eye on the news for the third shot if it come out hopefully soon.
That was about everything. I wanted to ask. Sorry, Doc. No, because I ran into Nurse Francis with the Airbnb. So, how's that going? Because I know you guys have a team, right, that does the vax for that.
Yeah, it's a very challenging, logistic wise. I tell you, it's a daunting challenge to coordinate the vaccine for the passengers that come in from Taiwan, from the Philippines, from Thailand. They come from everywhere, and it's a daunting challenge to try to accommodate them. Get the vaccine at the hotel, get the vaccine at the kiosk down in Tumon at the plaza. And not wasting the vaccine. It's a lot of work. I mean, I have a full team that I'm telling you, they work 12, 15 hours a day to put the program together, to make sure that we follow public health protocol and to document, to make sure that they have the verification, the PCR testing as they come out for departure. It's and I tell you, they are so appreciative of the program. We just to look at them, how appreciative and how much they want the vaccine, and for us in the U.S. that we have to, stimulate people to come in to get the vaccine. It doesn't make sense. It really doesn't make sense. But no, it's a good program, though I'm not sure how long it's going to continue to last. But I think that everyone that we can help in our country that near us to protect themselves from the infection, though every life we touch mean a whole lot. So, no, I'm glad the program is there, but again, it's a very daunting task to do this thing. So no, it's going quite well. We have scheduled all the way up to the second or third week of August. So there's quite a few more planes coming in.
All right. Well, Doc, we've got to let you go, but offline, we'd like to reach out to you and maybe do a feature on you and your staff, holding the line.
Yeah.
Okay.
All right.
Yeah, I'll be glad to. Just call us, okay?
Yes.
Thank you, Doc.
Thanks, Doc.
You're welcome. Have a good day, guys.
You too.
There you go, Dr. Hoa Nguyen of the Physicians Advisory Group. We now go to the K-Wave News Zoom room where we've been talking about this Marble Cave and erosion, flooding going on up at the area of the contracted GPA solar farm up in, that's the Marble area, right? Hello? Of course.
Yeah, Marble area.
And we did put out an ask to DPW Deputy Director Linda Bonas to get